David Mechanic, as the founder of the Institute, really was able to recruit some real giants in their fields to Rutgers. Too many to name that really set the Institute and established the legacy of the Institute.
David Mechanic was a great medical sociologist, but he had a bigger vision.
I originally had a small institute within the sociology department at the University of Wisconsin. When I came here, I had made some arrangements to have some similar small arrangement with the notion I would later develop something bigger. I got a call from, I think it was the provost at the time, saying that they wanted me to be the acting dean of the new faculty of arts and sciences, which they were setting up, which would merge the faculties of the individual colleges. And that turned out to be very successful. And so I decided to stay and establish the Institute. And then we went on and tried to recruit the very best people we could in various areas of interest.
I came to Rutgers 35 years ago, near the creation, 5 years after the original creation. My original founding colleagues were all greats in their own particular areas of research.
We developed a culture of supporting people and having them support each other, regardless of what they were doing in terms of their research, trying to create a community of people who showed respect to one another and got along with one another and collaborated with one another. So we were doing population studies, population health and social determinants of health long before there were labels for it.
When an opportunity came up here at Rutgers, it was really a meeting of an internal desire and a great opportunity that I could come up here, build something new, and along the way, advance the brain health of Asian Americans.
I learned all about addiction here at Rutgers, and so glad that, Rutgers, I'm back here full circle doing what I love to do, which is research and clinical work with people who are, lived experience with substance use.
The people who recruited me, Dave Mechanic and others, really saw a need for a university-state partnership to bring the assets of a university, the scholarship, the data, and so forth, to bear on the problems that the state is trying to solve. So David and others did the work necessary to set up the Center for State Health Policy.
The intellectual rigor, the focus on rigorous methods from different disciplines, realizing that many of the important questions in healthcare need multidisciplinary perspectives, need a multidisciplinary lens, need multidisciplinary methods to provide the correct answers, was something that David brought to the Institute and established as the culture. And it's really one of the clear priorities to preserve that culture, even if some of the specific areas of interest for the Institute have changed over the years. The research mission of the Institute really matches the research mission of Rutgers Health overall, to improve the health of the people in New Jersey and the world. Within Rutgers Health, we're a connection point that brings people together in a multidisciplinary environment across all of Rutgers Health, but also all across Rutgers.
One of the things that makes IFH, the Institute for Healthcare Policy and Aging, different is its ability to bring to bear multiple non-biologic, that is non-laboratory, professions and disciplines all in the same area. So you have people who are studying pharmacoepidemiology in my field, you have people who are studying health service research, you have people who are studying aging, you have people who are studying multiple different things, and that all of that requires collaboration among multiple different specialties, multiple different fields. And IFH is a building and a program where they all get together and they can all answer questions in common by having teams of people from multiple disciplines all working together collaboratively on a single question.
You have to understand it's inherently multidisciplinary, which is why you need these multidisciplinary groups. So everybody's perspective, the political science analyst, the epidemiologist, the biostatistician, they all have a particular perspective and they all need to be brought together.
Here we have an opportunity, because we're situated within the same institute, that the social scientists and the biological scientists can really work alongside each other to make this integration work.
Rutgers and IFH is probably one of the world-renowned hubs for being able to do collaborative research. So I'm able here as a clinical psychologist to be able to collaborate with physicians, medical scientists. I'm able to collaborate with people who are biostatisticians. I'm able to collaborate with people who know pharmaceutical sciences. I'm able to collaborate with pretty much just about anyone in any field of expertise who also have global and international connections as well as local community connections deep into the community. And that's what makes IFH unique among places. New Jersey is almost a microcosm of the census of the United States. It represents the entire population in this one state, and that richness is really what fuels the research that we can do here. And that's what makes Rutgers and IFH so special.
My strong emphasis was that people had the right to do research on the things that interested them and motivated them.
What the Institute does best is to provide actionable evidence that helps patients and their providers, but also political stakeholders, for example, through the Center for State Health Policy, regulatory agencies, and other stakeholders, where we bring an interdisciplinary lens to important questions regarding population health.
Our number one achievement is creating and sustaining relationships with our state across many gubernatorial administrations, both parties, lots of different senior government officials. They come and go. That's the nature of our system. But we have sustained those relationships and built a capacity to support decision-making no matter who's in charge.
We now have a wonderful portfolio with our center faculty spanning areas like intellectual and developmental disabilities and research on aging and the challenges of dementia, as well as opioid use disorder, different aspects, residential care for opioid use disorder, a lot of interest in healthcare disparities.
I would like to see IFH sort of expand what it is doing, which is addressing the most important public health and population health problems in the country and in the world. You know, what those problems will be 20 years from now, 10, 20 years from now are different than the problems now. But we need the capability to be able to move in a flexible way quickly to be able to address those questions.
I think it's not a fantasy to say that hopefully in 10 years we'll be able to make a fairly accurate prediction of what someone's health will look like over the next 5 to 10 years in terms of brain health, mental health, physical health.
We have to develop solutions that address the changing climate and how that affects health. And we have a new climate center, research center, that's going to really launch us into that big time.
Another new center at the Institute is the Center for Biomedical Informatics and Health AI. We know that biomedical advances in biomedical informatics and health AI will affect research in all facets of the work we do in the Institute and in health and in many other areas.
Science doesn't end when our careers end. We need to think about who's going to succeed us, who's going to follow us, who's going to do better than we did. We will carry fields up to a certain point. We want people who are smarter and better and trained in different ways to be able to carry the fields to the next. And a program like IFH, which is inherently interdisciplinary, can do that better than most places because it can take epidemiologists, biostatisticians, health service researchers, economists, historians, people of lots of different fields, bring them together and train students, trainees, whether student or postgraduate.
I think the Institute in the last 5-6 years has just done a tremendous job recruiting wonderful new faculty.
All the people here, and certainly the members of our center, are passionate about making a difference. They're values-driven. They really care about inequities. They care about all these disadvantaged populations.
A lot of us do research for the long term, and we know they're not going to change people's lives immediately, but we hope that over time that will sort of become part of the culture and will change the way people behave and how they respond and so on.
It'll be very important to grow with the times, to integrate new approaches, new disciplines, new centers into the mix for the Institute.
And I hope when we're celebrating in 10 years, we can say, well, we did some research that showed that fill in the blank really made a difference in people's lives. And I think we're on track to do that.
I wish you luck. I mean, I root for the Institute. I hope very much that they are successful.